In this session, we will discuss electronic security and information systems. At the end of this session, you will be able to describe the process for securing electronic information in a computer network and identify various methods of user authentication to security of a network. In addition to complying with federal HIPAA guidelines regarding the privacy of patient information, healthcare systems need to be vigilant in the way that they secure information and manage network security. Maury and Oakes discussed the vulnerability of electronic health records to data breaches. They suggest that as many as 77 persons could view a patient's record during a hospital stay. It is critical for information technology policies and procedures to ensure appropriate access by clinicians and to protect private information from inappropriate access. However, authentication procedures can be cumbersome and time-consuming, thus reducing clinician performance efficiency. Physicians spend on an average 7 minutes per patient encounter, with nearly 2 minutes of that time being devoted to managing logins and application navigation. Likewise, an average major healthcare provider must deal with more than 150 applications, most requiring different usernames and passwords, making it difficult for caregivers to navigate and receive contextual information. Healthcare organizations must strike the right balance in terms of simplifying access to core clinical data sets while maximizing the time providers can interact with patients without jeopardizing data integrity and security. The three main areas of secure network information are confidentiality, availability, and integrity. As required by HITECH and HIPAA, an organization must follow a well-defined policy to ensure that private health information remains appropriately confidential. The confidentiality policy should clearly define which data are confidential and how those data should be handled. Employees also need to understand the procedures for releasing confidential information outside the organization or to others within the organization, and know which procedures to follow if confidential information is accidentally or intentionally released without authorization. In addition, the organization's confidentiality policy should contain consideration for elements as basic as the placement of monitors so that information cannot be read by a passerby. Shoulder surfing and watching over someone's back as that person is working is still a major way that confidentiality is compromised. Availability refers to the network information being accessed when needed. This area of policy tends to be much more technical in nature. An accessibility policy covers issues associated with protecting the key hardware elements of the computer network and the procedures to follow in case of a major electric outage or internet outage. Food and drink spilled onto keyboards of computer units, dropping or jarring hardware, and electrical surges or static charges are all examples of ways that hardware elements of a computer network may be damaged. In the case of an electrical outage or a weather-related disaster, the network administrator must have clear plans for data backup, storage, and retrieval. There must also be clear procedures and alternative methods of ensuring that care delivery remains largely uninterrupted. Another way organizations protect the availability of their network is to institute an acceptable use policy. Elements covered in such a policy could include which type of activities are acceptable on the corporate network. For example, are employees permitted to download music at work? Restricting downloads is a very common way for organizations to prevent viruses and other malicious code from entering their networks. The policy should also clearly define which activities are acceptable or not acceptable and identify the consequences for violations. The last area of information security is integrity. Employees need to have confidence that the information they are reading is true. To accomplish this, organizations need clear policies to clarify how data are actually input, determine who has authorization to change such data, and track how and when data are changed. All three of these areas use authorization and authentication to enforce the corporate policies. Access to networks can be easily grouped into areas of authorization. For example, users can be grouped by job title. For another example, anyone who has the job title of floor supervisor might be authorized to change the hours worked by an employee, whereas an employee with the title of patient care assistant cannot make such changes. Authentication of employees is also used by organizations in their security policies. The most common ways to authenticate rely on something the user knows, something the user has, or something the user is. Most organizations today enforce a strong password policy because free software available on the internet can break a password from the dictionary very quickly. Strong password policies include using combinations of letters, numbers, and special characters such as plus signs or ampersands. Policies typically include the enforcement of changing passwords every 30 to 60 days. Passwords should never be written down in an obvious place, such as a sticky note attached to the monitor or under a keyboard. The second area of authentication is something the user has, such as an ID card. ID cards can be magnetic, similar to a credit card, or have a radio frequency identity chip embedded into the card. The last area of authentication is biometric. Devices that recognize thumbprints, retinal patterns, and facial patterns are available. Depending on the level of security needed, organizations commonly use a combination of these types of authentication. The largest benefit of a computer network is the ability to share information. However, organizations need to protect that information and ensure that only authorized individuals have access to the network and data appropriate to their role. A 2003 nationwide survey by the Computing Technology Industry Association found that human error was the most likely cause of problems with security breaches. The survey indicated that only 8% of such breaches were caused by purely technical errors, whereas more than 63% were caused by some type of human error. The first line of defense is strictly physical. The power of a locked door, an operating system that locks down after 5 minutes of inactivity, and regular security training programs are extremely effective in this regard. Proper workspace security discipline is a critical aspect of maintaining security. Employees need to be properly trained to be aware of computer monitor visibility, shoulder surfing, and policies regarding the removal of computer hardware. A major issue facing organizations is removable storage devices, so CD, DVD burners, jump drive, flash drives, and thumb drives, which use the USB port access, are all potential security risks. These devices can be slipped into a pocket and therefore are easily removed from the organization. One way to address this physical security risk is to limit authorizations to write files to a device. Organizations are also turning off the CD, DVD burners, and USB ports on many company desktops. The most common threats to a corporate network faces are hackers, malicious code like spyware, viruses or worms, Trojan horses, and malicious insiders. The number one security threat to a corporate network is the malicious insider. Acceptable use policies help to address these problems. For example, employees may be restricted from downloading files from the internet. Downloaded files, including email attachments, are the most common way viruses and other malicious codes enter a computer network. Network security policies typically prohibit employees from using personal CDs, DVDs, and USB drives, thereby preventing the transfer of malicious code from a personal computer to a network. Depending on the number of employees, organizations may also employ a full-time electronic auditor who does nothing but monitor activity logs. Spyware is normally controlled by limiting functions of the browser used to surf the internet. For example, the browser privacy options can control how cookies are used. A cookie is a very small file written to the hard drive of a computer whose user is surfing the internet. The file contains information about the user. For example, many shopping sites write cookies to the user's hard drive containing the user's name and preference. When that user returns to that site, the site will greet her by name and list products in which she is possibly interested. Weather websites send cookies to users' hard drives with their zip code so that when each user returns to that site, the local weather forecast is immediately displayed. On the negative side, cookies can follow the user's travels on the internet. Marketing companies use spying cookies to track popular websites that could provide a return on advertising expenditures. Spying cookies related to marketing typically do not track keystrokes in an attempt to steal user IDs and passwords. Instead, they simply track which websites are popular and are used to develop advertising and marketing strategies. Spyware that does steal user IDs and passwords contains malicious code that is normally hidden in a seemingly innocent file download. But this threat to security explains why healthcare organizations typically do not allow employees to download files. The rule of thumb to protect the network and one's own computer contact information. Organizations may also use devices such as firewalls and intrusion detection devices to protect from hackers. A wide range of tools are available to protect the organization's network and administration. These tools can either be software or hardware tools such as a proxy server. Such tools are effective only if they are used along with employee awareness training. For example, email scanning is a commonly used software tool. All incoming email messages are scanned to ensure they do not contain a virus or some other malicious code. This software can find only viruses that are currently known, so it is important that the virus software be set to search for and download updates automatically. Organizations can further protect themselves by training employees to never open an email attachment unless they are expecting the attachment and know the sender. Even information technology managers have fallen victim to email viruses and sent infected emails to everyone in their address book. Employees should be taught to protect their organization from new viruses that may not yet be included in their scanning software by never opening an email attachment unless the sender is known and the attachment is expected. Email scanning software and antivirus software should never be turned off, and updates should be installed at least weekly or ideally daily. Software is also available to scan instant messages and to delete automatically any spam email. Many viruses, antivirus, and adware software packages are available for fees ranging from free to more than $25 a month. The main factors to consider when purchasing antivirus software are its effectiveness, for example, the number of viruses it has missed, the ease of installation and use, the effectiveness of the updates, and the help and user support available. Numerous websites compare and contrast the most recent antivirus software packages. Be aware, however, that some of these sites also sell antivirus software, so they may present biased information. Firewalls are another tool used by organizations to protect their corporate networks when they are attached to the internet. A firewall can be either a hardware or software or a combination of both that examines all incoming messages or traffic to the network. The firewall can be set up to allow only messages from known senders into the corporate network. It can also be set up to look at outgoing information from the corporate network. If the message contains some type of corporate secret, the firewall may prevent the message from leaving. In essence, firewalls serve as an electronic security guards at the gate of the corporate network. Proxy servers also protect the organizational network. Proxy servers prevent users from directly accessing the internet. Instead, users must first request passageway from the proxy server. The server looks at the request and makes sure the request is from a legitimate user and that the destination of the request is permissible. For example, organizations can block requests to view a website with the word sex in the title or the actual uniform resource locator of a known pornography site. The proxy server can also lend the requesting user a mask to use while he or she is surfing the web. In this way, the corporation protects the identity of its employees. The proxy server keeps track of which employees are using which masks and directs the traffic appropriately. While hacking becoming more common, Healthcare organizations must have some type of protection to avoid this invasion. Intrusion detection systems, both hardware and software, allow an organization to monitor who is using the network and which files that user has accessed. Detection systems can be set up to monitor a single computer or an entire network. Corporations must diligently monitor for unauthorized access of their networks. Anytime someone uses a secured network, a digital footprint of all the users' travels is left, and this path can be easily tracked by electronic auditing software. Offsite uses of portable devices such as laptop, personal data assistants, PDAs, home computing systems, smartphones, smart devices, and portable data storage devices can help to streamline the delivery of healthcare. For example, home health nurses may need to access electronic protected health information via a wireless laptop connection during a home visit, or a physician might use a PDA to get specific patient information related to a prescription refill in response to a patient request. These mobile devices are invaluable to healthcare efficiency and responsiveness to patient need in such cases. At the very least, however, agencies should require data encryption when electronic private health information is being transmitted over unsecured networks or transported on a mobile device as a way of protecting sensitive information. Hotspots provided by companies such as McDonald's restaurants and by airports are not secured networks. Virtual private networks must be used to ensure that all data transmitted on unsecured networks are encrypted. The user must log into the virtual private network to reach the organization's network. Only data essential for the job should be maintained on the mobile device. Other non-clinical information such as social security numbers should never be carried outside of the network. Some institutions make use of thin clients, which are basic interface portals that do not keep secure information stored on them. Essentially, users must log into the network to get the data they need. Use of thin clients may be problematic in patient care situations where the user cannot access the network easily. For example, some rural areas of the United States do not have wireless coverage. In these instances, private health information may need to be stored in a clinician's laptop or PDA. This is comparable to home health nurses carrying paper charts in their cars to make home visits, and it entails the same responsibilities accompanying such use of private information outside of the institution's walls. What happens if one of these devices is lost or stolen? The agency is ultimately responsible for the integrity of the data contained on these devices and is required by HIPAA regulations to have policies in place covering such items as an appropriate remote use, removal of devices from their usual physical location, and protection of these devices from loss or theft. Simple rules such as covering laptops left in the car or locking car doors during transport of mobile devices containing electronic private health information can help deter theft. If a device is lost or stolen, the agency must have clear procedures in place to help ensure that sensitive data are not released or used inappropriately. Software packages that provide for physical tracking of the static or mobile computer inventory, including laptops and PDAs, are being used more widely and can assist in the recovery of lost or stolen devices. In addition, some of the software that allows for remote data deletion in the event of theft or loss of a mobile device can be invaluable to the agency in preventing the release of electronic private health information. If a member of an agency is caught accessing electronic private health information inappropriately or steals a mobile device, the sanctions should be swift and public. Sanctions may range from a warning or suspension with retraining to termination or prosecution, depending on the severity of the security breach. The sanctions must send a clear message to all that protecting electronic private health information is serious business. Technology changes so quickly that even the most diligent user will likely encounter a situation that could constitute a threat to his or her network. Organizations must provide their users with the proper training to help them avoid known threats and more importantly, be able to discern a possible new threat. Consider that 10 years ago, wireless networks were the exception to the rule, where today, access to wireless networks is almost taken for granted. How will computer networks be accessed 10 years from now? The most important concept to remember from this session is that the network and network availability are necessary evils that may pose security risks. The information must be available to be accessed, yet may remain secured from hackers, unauthorized users, and any other potential security breaches. As the cloud expands, so do the concerns over security and privacy. In an ideal world, everyone would understand the potential threats to network security and would diligently monitor and implement tools to prevent unauthorized access of their network, data, and information.